A couple of hours ago, the state wrapped up a meeting on the status of the coronavirus pandemic here in Arkansas.
Our Jay Burr was there, and he's joining us live from the Capitol. Jay, how are state leaders planning to address this resurgence of COVID-19?
Well, it was a very robust discussion, to say the least, here today, right behind the state capitol here, as many lawmakers getting a chance to ask some questions of healthcare leaders here in the state. And a lot of what the discussion pinned around was the status of hospitalizations here in Arkansas, but also the mask mandates that could be looming here in the future. Now, obviously, much of the mask discussion coming on the heels of the governor saying that he will call for a special session on the matter. But when it does come to hospitalizations, state epidemiologist Dr. Jennifer Dillahay and president and CEO of Arkansas Children's, Marcy Doder, well, they were also asked about that and masks. Now, Dr. Dillahay saying cloth masks do work against the spread of COVID, along with general hygiene practices. Dillahay, or Dr. Dillahay, I should say, cited a study from the UK and said one person who does not mask and is not vaccinated can infect up to 8 people. This is under the Delta variant, whereas with the original Wuhan strain, it was only about 2 to 3. But when she asked if masks work, she bluntly said they do.
Then there are studies, both on a small scale like businesses or schools, or in larger studies looking at hospital systems or cities or counties that show when they are implemented that they decrease the transmission of COVID-19.
Now, she also did stress vaccines as part of that. Now, some interesting stats to come from the discussion today was that the state has only 37 ICU beds available across the state. That's it. And obviously, those hospital census numbers do tend to fluctuate, but it does paint the picture. Now, at Children's, they say they have 21 COVID patients currently and say none of them are vaccinated, with 16 of them actually eligible for vaccinations. Now, both Children's and the Hospital Association say the biggest issue that they are running up on right now is staffing. The Hospital Association coming out saying that many people are just burned out. They're tired, and they're also seeing people who are about mid-career actually leaving at a faster pace than they ever have in history. They say other states that are also surging, and also the changing dynamics in the traveling nurse market have also been some things that they are struggling with. But they do say right now staffing is the biggest problem that they are seeing in the hospitals, because the physical space, the actual number of beds that they can produce, is not necessarily a problem right now. It's just being able to staff those beds. So definitely going to be an interesting conversation as we start the week here at the state capitol, as with the declaration of emergency coming tomorrow, and then possibly a special session coming up later in the week. But we'll keep you definitely updated on all things that are happening here at the state capitol. But for now, live from outside the Big Mac building, Jay Burr, KARK 4 News.
Jay, thank you.